As you're able and willing, please rise for the pledge.
Good, how are you? Yes, I am.
Allegiance to the flag of the United States of
America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good evening.
Okay,
Thank you all for
perfect.
coming
Thank
on
you.
this first full day of spring and International Happiness Day, according to NPR. We have not had anyone sign up to deliver public comment this evening, so we'll move right into the report of the secretary, and I would entertain a motion to approve our last minutes.
I move to approve the minutes of the regular meeting of Wednesday, March 6, 2024.
Second, Rebecca.
Rebecca, thank you. Any comments or questions? Usual excellent job. Okay. There's nothing further that we'll move right to a vote. All in favor? That is 5-0, and we're good. Approved, thank you. That brings us to the report of the chair. I have three things to talk about tonight. I'll try to be quick. We did have our town officials meeting last Wednesday, March 13th. We met with Mike from Elliott. The folks from South Berwick had a conflict that day that they thought they might be able to get to the meeting by the end, but weren't able to make it. So we just basically had a pretty quick meeting with Mike, and the discussion was really about budget. The Elliott budget's going to be finalized 3/28 for the select board vote. They're working a new process that involves town manager's budget with recommendations from the select board, and Mike was very hopeful that would go more smoothly. It includes a $21K line item to help us out with the improvements at the Elliott Elementary School playground, so that's cool. They're going to be out of their town hall in September for the renovation work, and they're still looking, to my knowledge, for a place to house their offices while that renovation takes place, renovation and expansion. They're in the design stage on the Murray Row Park improvements and in the concept stage on a Hammond Park Pavilion, which sounds like it would be really cool. They just had their audit and they passed, it looked good. We talked a lot about health insurance costs. And then Mr. Carrolley reviewed the state of the current budget, which we had our first workshop, and I'll talk about that in a minute. With Mike, and that's pretty much it. Apparently, there's a Facebook petition for put a light in front of the high school. That got mentioned to me. I don't know where that stands or what chance it has of moving the state in any way. But
I think it's important to note on that there has been a couple of traffic surveys done, one as early as this year.
Yep.
To be able to look at that, and the state needs to look at that. And the other thing they talked about was actual accidents on the road within that area, which is one of the factors they looked at, unfortunately, which does make you feel really good.
No.
So we've had those conversations at the town and school district level, and we've tried to carry that forward with the DOT as well. So
anybody else who was
No,
there?
covered it.
Got it? Okay,
Thank
cool.
you.
Let's see, second thing. Couple of things from the Maine School Board Association. Is it right there? So at our last meeting, Paula Gravel, who's the Director of School Finance for the state, for the Maine Department of Education, came to the Maine School Board Association Board and did a very nice presentation, a primer on how the ED 279 works. And we've, Ryan has walked us through that. Her presentation is going to be made available to the folks on the board, and I would like to suggest that we get it put up on our board website as just another resource for parents to understand, at least in part, how the funding model works and how we get our state subsidy. So as soon as I have access to that, I'll let you know.
awesome, thank you.
And then the second thing I wanted to mention is that although School Board Recognition Week at the State House is typically the third week in April, it's actually being celebrated this year on Tuesday, March 26th. It runs from 9:30 in the morning to generally early afternoon. I went last year. It was kind of a lot of fun to watch, to be able to sit in both chambers, and in the course of that to get recognized as hey, school boards are great, thank you. But also to just be able to sit and watch the work of the chamber get done. It was really very interesting. So if any of you are interested, Tuesday, March 26th,
Love that.
yeah,
I would love to go.
let me
where I
know
could
if anybody
be
wants to go.
here,
Maybe we can
but-
coordinate carpooling or something. Okay, that's the MSBA update. And then thirdly, I will mention that we, just before this meeting, we had the first of our 3 budget workshops where we, see if I can do this, where we talked through 5 of the tabs in the budget in detail. It would have been technology, transportation, facilities, administration and central office, and federal grants. That was the 5. I'll note that we went through them in some level of detail, and I don't think the board was concerned about any changes being necessary, so that was that. And that concludes my report and brings us to the report of the superintendent.
Awesome. Thank you very much. Before I get started with the Maine Integrated Youth Health Survey data, I just want to touch on the budget workshop really quickly. I've had a couple of questions this week about things around the budget, and I just want to remind people that the budget presentation is available on the website, so people can go on and watch that presentation. One of the tricky parts when you do a budget is that the budget's created before course registration takes place. And so obviously, anything that we do is contingent on what the course sign-up looks like for students. And so I think there was a misnomer out there that we were looking to cut a science position, and that is not the case. What we need to do is we need to see like what courses kids sign up for first. And so it's something that we're always going to monitor as we do with everything that we do. The other part that I just wanted to be clear about is there's a question about the reduction of the high school chorus position. And I just want to be clear that there is no impact on students. You know, if you look at the data that we provided, literally combining one classroom, moving a study hall, students would still have the same opportunities that they had before. So there isn't any student impact. And so I just want to be really clear that we don't articulate any student opportunities. That would be the last thing that I would ever recommend, is to take away student opportunities. So I just, you know, I think sometimes when you look at the budget in a paper form, as opposed to maybe hearing it explained a little bit differently, might be helpful for people. So I just wanted to share that that is a resource for the community to look at. And if there are questions, certainly reach out to myself or Ryan. Be more than happy to be able to answer any of those types of things. Next is we have Sally Mannon in here today, and she is agreed to kind of share our Maine Integrated Youth Health Survey data. And so this is some of the data that we have looked at in the past, where it's around at-risk behaviors and healthy behaviors for students. And so this is something that we built a lot of our work on in the last year's budget. And so here's a chance to kind of look at some data that was taken. Was this done in October, Sally? February.
Yes, there's a bunch.
When did we take it though, Sally? When did the kids take the assessment?
In 2023. Can we take it one more time? Take it in November. The November one was the
2022.
2021.
Yeah, perfect.
And the data, oh, sorry. There you go. Sorry, we're doing this very low tech here because I'm there. Yeah, so, actually, start out and hopefully, this is, the printout looks like what I'm looking at, that would be helpful. So let me just start out with who I am, and then I'll talk a little bit about the survey, and please don't be shy, John, to just cut me off, because I might just keep going on autopilot. So first of all, thank you for having me here tonight. I always appreciate speaking in front of a school board, and Marshwood or MSAD 35 has always been great about that, and did it last time in 22 is when you got your presentation, Heidi, wherever you are, and that may have been why you were thinking you had another survey. So you had your last presentation of 21 data in 22. So I'm Sally Mannon, and I work at York Hospital. I'm the director of community health, but what I really am mainly is I'm a substance use prevention specialist, and we have 3 grants at the hospital to do youth substance use prevention, and we've had them for quite a while now, going on 20 years, over 20 years now. 2 federal and 1 state grant. The good news, just real quickly, is that the state funding is more certain. It's secure. That's the word I'm looking for. It's more secure now than it has been in the past, so that's good because then you folks know that it's not all up to whether I can write a good grant or somebody else can write a good grant. We cover all of Southern York County, 5 school districts, including yours. I just did the York High School presentation today for their staff, not for their board yet. So I'm on to the next slide. This is a little awkward, sorry, about the survey itself. Just to say, as John was mentioning, it's done every 2 years, usually in early February. The one during the pandemic was in November. I don't want to go on and on. If any of you are math teachers or statistic nuts, hopefully you'll understand this and be able to talk about it with others, but it's an anonymous survey, it's voluntary, large samples of kids. You have all your students do it. So the concern that some students are lying or some students are exaggerating is really nothing to be concerned about. There might be some outliers that do that. It doesn't affect the overall quality of the picture that you're getting. It's a tested survey tool. And what I've done in this presentation and the way to think about this is you want to look at this data and think about how you're doing in the school, but also ideally I present this to parents, to community, to everybody, because it takes a village. Prevent substance use or promote good mental health. As we know, it's up to all of us. It's just that you have a lot of power in this arena because you do see the kids so much during the day. And I apologize to the young people in the room. I'm old, so sometimes I say kids, and I do not mean that in a derogatory way. I'll try not to say that.
Okay, kids?
Okay, kids, please don't hate me. You can say, okay, boomer or something to get back at me. We use the data to get grants. I think I said that before, but you all hopefully will use it to do a lot of things. And Marshwood, Heidi, and the principals and John have been great about having Gina and I come and do all sorts of things with your staff. And we're going to do something with students on the 29th with students and staff. So that'll be great to look at data and do some action planning. So the first, turn the page. The first major slide here, we're looking at past 30-day drug use. That's one or more. And if any of you have questions about the questions or the survey or any of this, please interrupt me because I don't know how many of you are used to looking at these numbers or looking at this survey data at all. So I've been compiling it for quite a while. One slide, just for the most part, I want you all to see, and I do this for all the schools in our area, that the trend is for the most part pretty positive. And that, what do I say there in that little call out square, most youth do not use. So remember, this is past 30-day drug use. So what we're getting at are the number of young people, I almost said kids, young people who are saying that they use these substances one or more times in a month. It's the best indicator we have of current use. So we're not talking about some young person who tried alcohol and didn't like it, tried cigarettes and didn't like them. Those numbers do tend to be higher, but the young people that use on a regular basis. And so you can see we being all of us, have made a lot of strides with all of these areas. And if you look back to the old days of the 70s, alcohol use was, I'm trying to remember, I should get it into another presentation to show people. It was somewhere around 50 or maybe even higher percent. So over the course of 20 plus years, we really have made a huge difference as a society, even though it doesn't feel like it all the time. And I think we get hung up sometimes on, rightly so, on dealing with the negative effects and the unfortunate situations and the people that we love and know. But I want you all to keep the perspective that for the most part, the trend is improving. And you can see even with alcohol, it's improving quite a bit. And alcohol continues to be the number one drug of choice for young people, for adults, all across the country. And I think the marijuana numbers, while 21% is still a kind of a high number of high school students, that's not bad considering legalization and the proliferation of retailers, especially in your area, your neck of the woods, because that's one of the things as a prevention person that we look at, access to a substance. The research says young people are more likely to use a substance that's easy to get a hold of. And so one of the things we were saying to the teachers that we spoke to today at York High School was, don't get hung up on the substance du jour, right? Try not to get too hung up. All drug use is harmful to an adolescent brain because it's still developing. You don't need to be an expert on the latest trend. Sometimes we need to know about the latest trend because we might need to do the treatment or the prevention might be different. But for the average situation, you know, just say it's all harmful for an adolescent brain because it's still developing and because it gets in the way of learning and memory and critical thinking, etc. But that's a whole nother presentation. I'm going to, because I don't want to take too much of your time, I'm going to kind of fly through the middle school slides. I included the middle school because what we see, as you can imagine, is most middle school kids, students, do not use. And typically they don't, and that's a good thing. And then you see a big jump between 8th grade and 9th grade. But I'm including it because you're the school board, but I'm also including it because what we are seeing, which you can see on the next slide there on your piece of paper, past 30-day use of the middle school kids. And now this is just the past 3 years. So look at my titles there so you don't get confused. I don't have middle school data for years and years. I have it for the past 3 years though. It's going up. So for instance, and then Maine, to give you a comparison of like, well, okay, how is Marshwood doing compared to Maine? Maine is the green, and hopefully it looks green on your piece of paper. Yes, it does, olive green. So for instance, with prescription drugs, young people said that they used one or more prescription drugs without a prescription in the past 30 days, 3% of your kids. That was an increase from 0% the previous year. So it's really small number, but it's going up. So when I write my progress report for prevention efforts in our communities, I say things like, middle school numbers are still low, but we're concerned because we're starting to see an increase. And again, your school wasn't the only one that we saw an increase. And so the other thing I want to say to you, as indicated at the bottom, the bold, if a number's in bold, that means it's statistically different, significantly different than the state. So your middle school kids are even though the rate has gone up, so it's good and bad, that's bad. The good news is it's a much smaller percentage than the state. So that's good. Cigarettes, virtually no use, but we'll see something different when we look at vaping. And so that's good. Your kids in middle school are not using cigarettes. 2% of the Maine middle school kids are. So there's a difference. Marijuana, that's an interesting improvement. But again, these are small numbers. So you know your population better than I do. So you could look back and say, well, what was going on in 2019? We had 5% of the middle school kids using marijuana, and now we have 0. I don't know what that means, but that's good. And then you can see the alcohol numbers, et cetera. So I'm not going to go in great detail on all of the middle school numbers. Like I said, it's hard to get through all this in less. We had an hour and a half this morning in York, and we didn't get to all of it. So there's the past 30-day drug use. This is a little bit of a repetition, but now you get to see the past 3 years because that's a trend, right? And we wanted to see, well, what's going to happen after the pandemic numbers? Because a lot of the schools, the pandemic numbers were in drug use were lower. And there's a lot of hypotheses we could have around that, right? Maybe it's because young people were at home and not able to access substances as easily. Maybe it was because they were home and their parents were home with them. So everybody was together and there wasn't an opportunity to be drinking or using marijuana, et cetera. But the numbers were lower. And then, and so we wanted to see, okay, what's going to happen in 2023. So now we have that data. Your marijuana numbers are continuing to go down though, which is really interesting. That's not true in all of our high schools. So 2019, 26% of your students said they had used. 2021, it went down to 23. And then 2023, it went down to 21. That was hard to say. A little bit higher than the state of 19, but not much higher, not anything to be horrified by, or to wonder why, I guess is a better way of putting it. And then you can see also a positive trend with alcohol. Any questions or thoughts so far? And then here we are with vaping, which, so we know that the kids of all ages, young people of all ages are not smoking cigarettes as much, which is a good thing. But unfortunately, they might be getting their nicotine through a vaping device. So here's the data for middle school kids. Again, these are small numbers. One of you people that is younger and faster than I am could figure out what 2% of your middle school population is. Very small number. But quite a bit less than 6% at the state level. And at the state level, I'll try to explain this so that it's understandable. At the state level, the kids get asked more questions and more in depth. So there are several different versions of these surveys that get handed around the state, and they do it randomly. So when you look at the state data, you can really drill down on some things that you can't on your school, which is aggravating, I'm sure. But in any case, so, okay, what are middle school students in Maine in general vaping? The last time you vaped, what did you vape? Almost half of them said nicotine. So good news is it's a small number. Bad news is half of them that are vaping nicotine. Almost 20% are vaping marijuana. And what page are we on for you folks? We're on page 3. There you go. 17% say it's just flavoring, which is, I don't know, yucky. I couldn't help but make a face. 18% are not sure, which is also scary. That young people are using something and they're not even sure what's in it. And let's see if I included a slide. I did not include a slide on vaping dangers, but if you don't know, a lot of young people have the misunderstanding that a vape device is just water. So they think it's safe. It's not just water, number one. It's an aerosol and it's a combustible thing. So there's all sorts of horrible stuff in it. God knows what, leads and formaldehydes and whatever, and then the combustion in it. So they need to learn that even if it's just flavoring, it's not a healthy thing to be doing to your lungs, number one. And then the second part of this that's really frightening, I think, is that the nicotine in a vape device is, there's a lot more of it in one vape device. And I see you nodding, so a lot of you already know this. But the kids don't seem to know this. So they don't realize that that vape device has more nicotine than a pack of cigarettes, and they're probably going through a lot of vape devices, and they're also doing it, they tend to do it faster. So it's like, they're getting a lot of nicotine in. And that's an addiction. I mean, if they're vaping in the schools, they've got a substance use disorder for nicotine. They need treatment, probably. That would be my guess. Did I do all the vaping? I did all the vaping. Any questions about vaping? Or I know there's concern about, all the schools are concerned about vaping. Every time I try to present the LGBTQ data, I get kind of tongue-tied, but it's, if you look at your data, not this, but John, you've got access to the actual full report from the state, and that, I'm sorry, I could have brought copies of that as well, but if you look at that, and if you look at the main full report, you will see all the data. It is pretty confusing because they asked the question in a lot of different ways. They asked kids if they identified it as lesbian, gay, bisexual, or something else. Then they asked them if they were transgender, and then they asked them in a different way. So basically, this is what your middle school students said to lesbian, gay, bisexual, transgender, or questioning. 21% of them said that that's how they identify, and that's about on par with the state. Little bit higher at the high school level. And then this one was separated out at the high school level. It wasn't at the middle school level, again, so this gets a little confusing. So the high school students were asked a different way, and it's a higher number of LGBTQ. There's no questioning. I mean, there's questioning, but there's no transgender. The transgender was separated out to be also asked, I should say. So it's 7% in your school identified as transgender. Now, I called the person at the state and I said, well, you've asked the transgender kid twice. So now they're in the 28% and the 7%. And I don't know which, I don't even know how to present this. And I said, I'm presenting this on Thursday or on Wednesday. Can you give me a call back? And he didn't. So I'm just reporting it how it is in the report. And I don't quite understand that. But basically, that's how many kids are reporting their.
I would
Yes.
assume that there's a complete overlap. That
There's an
all
overlap.
That the 7% that identified as transgender also answered yes to the LGBT
Right.
question, I would think.
But then it's hard to, it's just hard to look at past years and
Yeah.
compared to the state, and
Right.
and 28% is higher. I remember when your high school students, it was around 21%, and it's just hard to
Sure.
yeah, it's just confusing to me, so I have a hard time with it. The next couple slides, and now we're on page four, and those are slides not from me, they're from someone at the state, and they use the 2019 data. I don't have anything more current, but in that year, they probably had some extra funding to do some extra analyses, but this is important information. And here, this gets at the confusion. So now here, it's just LGBT. They didn't include the questioning kids in this data correlation for some reason. But it shows you how much more likely these kids are to suffer from substance use issues. And then the next one shows you, the next page, on page 4 we're on, shows you they're more likely to have negative mental health outcomes. And just to be clear, though I suspect you all already know this, it's not the fact that they are LGBTQ plus youth. It's because of the fact that they are often, but not always, discriminated against and felt and made to feel less than. And we're going to talk about that later, because we've done a lot of work lately in your school and others on just the feeling of that kids need to have to feel that they matter. And so unfortunately, some of our kids that are marginalized because of their status tend to suffer more. So here's, and I'm running out of time here. So now there's some data in here where you're looking good, and I put a star to remind myself to say that. The kids at middle school level, they are doing better than the state at knowing that marijuana use is harmful, and they're doing better than the state at thinking that it's hard to get. Because remember what I said before, access is a big predictor of use, and as is whether young people think it's harmful or not. But then at the high school, those numbers don't look as so positive. And unfortunately, at the high school level, on your survey, the harm question was left out for 2023, which is really unfortunate. Your data was going in a somewhat positive direction, although not very many kids saying that they think marijuana use is harmful. Oh, and I should define marijuana use. On the survey that it said using marijuana 1 or more times a week. So we would call that regular use. So it's not surprising that the kids in this area are saying it's not very hard to get. Only about 40% of them say it's hard to get. And you can see by the bold that that's hopefully you can see that. Where are we now? We're on page 5. The bold number shows you that unfortunately that's worse than the state. But that makes sense because you have a lot of it around. Yeah. Which means potentially, but we don't know this, there might be more adults using in your area, but we don't know that because we don't know, customers could be coming from Massachusetts for all we know and buying marijuana and going home with it. Here's the same question with the alcohol use. Again, doing well at the middle school level, believing that it's harmful. Oh, they don't know. We didn't have that question at all at the middle school level, but that'll show you what the state rate is, 65%. So we tend to do, there's a pattern here. The pattern is we tend to do a good job as parents, as communities, as teachers and school folks with our middle school kids. But then we kind of get a little, something happens, it drops off a little bit with high school. And adolescent development is what happens as well. And so then there's the alcohol use. Did I already do that one? I feel like I already did that one. No, I guess not. That's the high school data. And we are now on page 6. Thank you. I'm sorry about the pages. But a good thing that I printed it out, because if I hadn't, you'd really be confused. But let me just jump ahead. Mental health has been an issue. I just want to say, I said this last time, it was an issue before the pandemic. And we talked about it as prevention people. You probably talked about it. I'm sure teachers and counselors talked about it. But then it got much worse with the isolation and, depression, anxiety. And one of the factors that helps all of us as human beings be healthier is to be more connected with each other and with positive institutions, positive things in our life. So you can see that unfortunately the mental health data is not great for Marshwood, nor is it for any school anywhere that I know of, certainly not in Maine. And so there's the question about feeling sad or hopeless every day for 2 weeks. Ever is the way the middle school kids are asked. A little bit less than the state, so that's a positive. And then considered suicide, that's a frightening number, 16% of your middle school kids, because you would hope that they wouldn't be thinking about that at all. But it is significantly less than the state, so that is something. And then there's the mental health questions for high school students. It's gotten better since the pandemic year in the feeling sad or hopeless, and that's a good thing. We're still right up there though. And then the considered suicide also has gone down a little bit. I'm going to skip through. I think a lot of you know about ACEs. That's a pretty self-explanatory where are we? Number 7 chart. Marshwood, like York, similar numbers. We're very fortunate in York County. There are a lot of things that don't affect the kids in our area as much as maybe in some of the more areas where there's more food insecurity and more homelessness or being unhoused. I know we do have that in our part of the state, But perhaps the reason our numbers are not as bad as the state numbers is because of that, because of those two things anyway, being less likely. And for you young folks who weren't here last time, I don't know if you know about adverse childhood experiences, but basically it's trauma, but it's specific kinds of trauma. It can be anything from that's as common as divorce to losing a family member to sexual abuse, physical abuse, extreme poverty, substance abusing family, etc. There's a big long list. The young people like yourselves are asked to check off how many, bless you, affect them. And the fascinating and horrible thing is that adverse childhood experiences do have a huge predictive factor in a lot of different issues. As you can see, there's just a few of them there. So this was a really important question that we've been looking at quite a bit in the last few years. The bottom line on these who do you get help from questions, there's the middle school and then the high school, and this is Maine. This is not specific to Marshwood. The state didn't collect the data for your school specifically. But what we see is this trend of young people who are depressed not getting help, not asking for help. But when they do ask for help, most of them are asking parents and adults. And so when we talk to parents, we say, you're still the number one influence. A lot of kids asking friends or another young person. And that to me says we need to empower our young people to know how to talk to each other about sensitive topics like mental health. Whoops, wait a minute, I'm missing one. There's the high school, very similar kind of numbers. And an improvement in kids asking for help from teacher or another staff person. But that's always the lowest. And we were talking about that with the counselors and the teachers today at York, and we always say the same thing. Please don't be offended by this. You just need to understand that for some reason, a lot of young people, and I don't know if you guys can have any thoughts about this, a lot of young people we talk to, Gina and I, will say something like, I didn't know I could talk to my counselor about this kind of thing. And that seems like, how could you not know that? But they don't. And so what we say is you need to constantly remind the kids of who they can talk to. And that if they don't get along with the counselor or whatever, they need to think about one or two caring adults in the school or in the community that they can talk to. We're doing a youth summit in April, beginning of April, and one in May for 8th graders. And we always have the kids take a index card. We give them a help card, talk about who they can go to when they have problems and when they have things they want to talk about. But then we also give them an index card and we just say, write down 2 or 3 names of an adult, a caring adult you could go to if you had a problem. And we don't ask them to share it. We just want them to be thinking that way. So that's something that a lot of schools have been working on. It has improved. It went from 1% to 3% in Maine. So, and I'm sorry we don't have the Marshwood data. It'd be interesting to see, because I know, we've done work with your counselors and you've done work with your counselors to empower them to feel like they can talk about mental health and substance use with the kids. I need to move right along. Mattering is a big thing that we've worked on. I've mentioned it before. It's feeling seen, heard, and valued. And it's a really big predictor of whether people will become involved with substances or have mental health challenges. And your kids at the middle school level, nice high number there. We'd, of course, like it to be higher, of feeling like they matter. And most of them feeling like they have a teacher, at least one that helps and supports them. Numbers aren't as great for the high school kids. It's around 50, and it's gone down a little over the past few years, so that's unfortunate. We want to see the next time their survey comes around, we hope that the kids will feel more like they matter. But remember, the question is, says, do you feel like you matter to people in the community? So you're the school. This is, you know, and so when we talked to them, we did talk about this with them, and now I'm on page 8, thank you. And you won't get the benefit of my animation here, but a little animation. We basically asked 500 youth in Kittery, York, and Marshwood schools. We talked about mattering. We told them what it was. We gave them a little video clip on what it was, and we said, what makes you feel like you matter or would make you feel like you matter? And they said some really great stuff. We shared that with the administration, and I think there's been an effort to have the adults in the school, you know, think about what can be done differently to make kids feel even more like they matter. But remember, for the most part, this is where young people do feel like they matter. Community maybe not as much, and that's something that Gina and I are working on. And actually, we just met with someone from Kennebunk Savings Bank, the manager in York, and she's going to be working with us on some different projects. So mattering, anybody can do, right? Anybody can connect with a young person in a positive way. And on that last slide on page, oh, nope. Well, that's unfortunate. You don't have this slide because I added it after I printed this out. But basically, 60 kids who feel like they matter are 65% less likely to consider suicide. That's huge. 57% less likely to report being depressed, 24% less likely to use any substances. And the other thing we say, besides be a role model, monitor children, create good positive connections, you need to all message that any drug use for the adolescent brain or body is harmful. You don't need to be an expert. We had a very passionate, well-meaning health teacher from one of our schools say, I don't know what to say. I've had students coming up and asking me about mushrooms. What do I say about mushrooms? Where do I get a lesson on mushrooms? And we were like, calm down. You don't need to know about mushrooms. You don't need to be an expert on mushrooms, and you're not going to find a lesson plan on mushrooms. I said, if you really want one, there might be a lesson plan on psychedelics on the National Institute of Drug Abuse. But really, you just need to keep that consistent messaging of, you know, it's not good for the adolescent brain or body. And I think a counselor would probably say, the first retort would be, why are you asking me that question? And what is it that you know about it? And then go from there. But so that's what we really tried to do today. And I'll say it again when we meet with the students and the staff on the 29th, is that don't get hung up on the drug itself and think that you need to be an expert. You don't. You just need to be a caring adult and to follow some basic prevention strategies, which is my last slide. And I've shared this with, these are all proven prevention strategies that can be, should be done in the school. And I've shared this in a few different places. And John, when we do our March 29th event with staff and young people, that we'll work this into it somehow, just kind of an assessment of how do you think your school is doing with this aspect of the environment. Is you know, and the big one we've been working on, restorative process, and I have an excellent story about that, which we heard at the development day. I think I can share it. I'll share it in a positive way, obviously. So the restorative process basically is that you're helping students who use, that have gotten into trouble because of their use. Your priority is that you're helping them. You have to give them consequences. We're not saying you're not giving them consequences. We're saying avoid the out-of-school suspension, because we know it doesn't help them in any way, and it might actually make things worse. And so it's about a team approach. It's about assessing the young person, having a counselor, talking to the young person, We taught them a formal 3-meeting approach, and then bring the family in, discuss everything with the family, create a plan for how this young person is going to be restored back into the place that is their most positive environment, probably. And so that's basically what a restorative process is. And I'll just share that I don't know, maybe I shouldn't be sharing. Can I share the story about the young person with the vaping incident? Well, I guess I'm already sharing it. I'm not going to name them. But the point was, there was a young person who was caught vaping, and instead of being suspended, they got help. I won't go into the details, but it turned out because the counselor talked to this person and had these meetings, it turned out the vaping was the least of this person's problems. They had mental health challenges, they had other challenges. When the family was brought in, the family didn't know about this. Now this person's getting more help. I hope it was okay that I shared that. I realized after I started
So
talking
when
that,
we talk about the 3-meeting model, when you first talked about that, that's exactly,
Yeah.
this is
Yeah.
exactly what we're talking about.
yeah,
So
yeah,
Yep, yep.
yeah.
The
And
other part, just the 29th,
Yes.
I just want to give people a
Yes,
sense of what we're
yes,
trying to
what
do.
we're
So
talking about.
We're taking this data a step further. So 2 years ago was the first time we've ever presented this data to the board. And so we're doing that again. And so now what we're going to do is we're going to take it to a group of students, middle school students and high school students, and really model how do you gather student voice. And so ultimately, this is the students' data. This is a reflection of them. And so now how do we take that data and how do we process it? How do we draw conclusions from that? Then how
what do
we-
they think of
Yeah,
it?
and then
Right.
how do you create an action plan on how do we address 3 or 4 of the top issues? What does that look like now? How as a student body do we do that? The adults are there to observe and to be part of it, but also to kind of more so see how that process looks in order to how to solicit student voice, seeking those opportunities.
And I think it'll be great, and it is also, besides a great thing to do. I mean, first of all, whenever you survey someone, you always want to share the results with the person you surveyed, and help them understand why that was so important. But also, you're providing the young people with a positive connection and a positive, meaningful involvement with their school environment. Not just, so we don't say, make sure all of your students are involved in sports. It's not that simple to prevent substance use. What's more important, maybe even than the be involved in sports, is to have a positive connection with your school environment. Be involved in the governance, be involved in the decision making, be involved in, what's the school going to do around the vaping issue or whatever. And so that meaningful governance connection is what's probably more important for the young person, even than being involved in a sports team, although that is important because of the physical health aspects, of course. But so that's a great example of a good thing to be doing, and we look forward to it. It'll be fun.
Can I just
Yes.
ask a clarifying question?
Yes.
Is that group of students going to be like just Student Gov, or is that going to be a wide range of
I know at the middle school, it's about 25 students, I think. That's kind of from all over.
Might it be some students who are maybe like some
That-
at-risk students?
That was the
with
goal.
some- Okay.
Is it's going to get a wide perspective of student
Great.
voice.
Yeah, and it is good to have. I've done things like this before, not in quite a few years, but we had a diverse mix, and that's when you
Great.
get some really good input.
And you talk about mattering, right? And so student voice is a way that you can
Yes.
show students that they do matter,
Yep.
right? Of having those conversations and being good listeners and being able to process
Right.
through things and be able to come up with goals and objectives.
And one of the things that the kids said over and over and over in all of the schools was, I feel like I matter when people ask me my pronoun, when they ask me my name, when they use my name, when they listen to me, when they ask for my opinion. I mean, really simple stuff, but it makes a huge difference. So,
One more question.
sure.
Does the survey ask any self-harm questions?
No,
No. Okay.
just the considered suicide, and then on the state, there's attempted.
Okay.
And there, yeah, no, it doesn't. I'm
Okay.
just thinking here about the main.
I-
Yes. They've changed things. Well, it's changed. It's changed quite a bit, and I'm pretty sure there's nothing about self-harm.
way back though.
But it might have been, you're right. It's changed over the years, and it has to do with funding and politics, and, you know, we've got a lot of funding right now to look at all of the risk and protective factors through the lens of gender identity and orientation. And so if you look at this state report, it's like 1,000, I don't know what it was like 1,000 slides long. And because they did a crosstab with LGBT or not LGBT for every question to see the differences. So sometimes when the state has a focus, that's what happens. It's for good and for bad. So, but thank you. Good question.
Thank you.
Thank you very much.
Appreciate it.
Appreciate you having me. That was a little bit better than last time, Joe, wasn't it?
We were
Was it?
missing half the slides. Sally.
Yeah, that's right.
So, Sally, just one last question, one final question. You look at all of this stuff so much, like this is your forte. Like what is your
one of-
takeaway here?
Yeah, the
yeah.
takeaway is mental health. Mental health. What are you doing with the 24 to 30% of the kids that probably need a brief intervention? They don't need treatment necessarily. Some of them might, but they need something. They need help quitting vaping. They need somebody to talk to them on a regular basis about marijuana. The mental health, the making sure kids know who to talk to, making sure that your staff has the time and the capacity to be able to talk
I
to.
saw that on here. I was gonna ask you about that. I think that's so critical, but the question is, how do you do that?
And that's,
Building and supporting staff capacity, it's so easy to say, like, we know that, you know, and so it feels,
and
But we do a really, really good job with our school counselors
You
to
do.
ratios, where
You do.
I think that the
You
national
do.
ratio is 300 to 1. I think at the high school it's 160 to 1. And so, you know, that should not be a barrier. That's
And-
why our goal is to have, 2 meetings at a minimum with every student every year. And that's the expectation. And so, like, building those opportunities to have time to be able to do that. But if you value it, you've got to build the time in to do it. So.
and you folks are doing well. I don't know everything everybody does, but you are using a lot of different community resources to do that very thing. So you hire Gina to do a counseling group. That's not what it's called. She does like a clinical session with your counselors on a monthly basis. And we've done a lot of work she's done a lot of work with them on helping them through that 3-meeting process and holding their hands to encourage them to understand that they don't need to be experts to just talk to a young person and listen. I shouldn't even be saying talk to a young person, listen to a young person. Because it's like the doctors at the hospital that I've spoken to about, you need to be doing a brief intervention with young people and asking them whether they smoke or drink or use marijuana, and the providers are afraid to, and they're grown people that have gone to medical school and they don't feel like they can. They're like, well, I'm not an expert on that. Well, you don't need to be. You just need to ask the right questions and to listen and to let this young person or your patient know that you care about them,
they matter.
that they
And that
matter.
doesn't have to be necessarily a counselor. And
No, and it
the
doesn't, right.
The other thing that I just get concerned about is, you know, at our high school, yes, we've changed the focus of our counseling program a little bit, and that's been really, really great. But there is a big focus on, you know, your future, what
Right,
you're gonna do,
right.
and we need that.
Right.
We also need more social workers. I mean, I think that's what we really need, is just more actual emotional support, and this type of support where there's literal experts who, this is what they do. They listen, they help, they provide resources, and it's tricky.
It
I don't
is.
think there's a school and district in this
No.
country that
No.
has that.
And not to be too much of a downer, but the workforce in that area is
That's right.
struggling, right? There aren't a lot of young people that want to be a mental health counselor or a substance use treatment counselor. Now, Gina and I are working with York County Community College. I don't know if you know, but they have this wonderful new behavioral health program where young people can get certified to be a community mental health worker and a certified alcohol and drug counselor. And so, Kathy, who's the professor, I can't remember how many students, but she's filled to capacity, like it's more than they had hoped. And so Gina and I have spoken to the class, and our goal is to, and certainly your counselors could be doing this more effectively than we can, but our goal is to help bridge YCCC students to our schools, right? So that they can have internships at all of our schools, since we're lacking in this, bless you, in this profession in general. Let's get these passionate young people to help in some way.
And let's get our state and our federal government to start passing some policies that put funding into this entire idea and make it universal.
Well, and as you hope maybe know, John and Heidi went with me this year to the conference in Washington, D.C. We spoke with Senator King, we spoke with Senator Collins, and they heard that loud and clear. And they've heard that in previous years, but they heard it even more so, I think, this year.
It's different now.
Mental health, mental health, mental health. You've got to, I think one of the suggestions we gave was, give more subsidies and grant, what's the word, when when people are allowed to,
Reapply for the grants here.
where if you become a mental health counselor, you don't have to pay back your student loans.
Oh, the forgiveness.
Forgiveness. I couldn't think of the word forgiveness. Right. So we talked about a lot of that and how it's a real need, and they're getting it. And, of course, there's other financial issues going on in
I
DC.
think our biggest issue is that our school counselors can't do long-term one-on-one counseling with
No,
students. So we have that person who does the short-term counseling in order to try to get them to another professional with outside help. The problem is that
There's no outside help.
Exactly
Right, like that's really the
But
issue.
by the way, it's all on the school to figure all this out.
Yeah.
Right. I know, it's just ridiculous. And then you have passionate counselors. I mean, I've met them all. I think you do. I mean, I think they're amazing. Not all of our schools, you can tell. I can tell the counselors that really don't want to be talking about mental health and substance use. They just want to be talking about college stuff. But your counselors don't seem that way to me. They seem very passionate and willing, but, they're busy with all the other things they have to do. So, I mean, I think in a lot of ways you're doing a lot of great work and just facing the same struggles that we all are, which doesn't make it better, but,
No, it doesn't, but it's nice to hear we're not alone. We're not the only
Right,
ones with
right.
the same frustration.
and
But I thank you for everything
Oh,
that you do.
oh, thank
because
you.
All the grants that you get and the work that you do and coming to the schools and providing the service and the expertise and the data
oh, you're welcome. Thank
download.
you.
And it's just amazingly helpful.
Oh,
I
thank you,
I was
Lisa. That's very
honestly,
nice.
After that last presentation a couple years ago, I left here crying. Yeah.
Well, and that was
I'm not gonna say I feel a whole lot better right now, but it's good to know and it's good to see there's little bits of
There's
improvement,
definitely
and
some
that, you know, it's
improvement.
like
And
moving the needle in the right direction.
try to remind yourself that it's not all on you. I didn't include the slides in here about the community role in all of this, the parent role in all this. You can only do so much. All your parents of 8th graders got a parent handbook to teach them about how to talk to their kids about everything from vaping to alcohol to marijuana to gaming to that we purchased with our grant funds. Your awesome kids from the high school helped me hand them out. Were you there? Did I see you there?
Yeah.
That's right. You were there. You weren't there though, but I saw your parents.
I was in the gym.
You were in
I
the
wasn't
gym
hanging out, I was there.
on parent night. But such cute, wonderful young people. And we just, and it's funny when you ask the parents, I made the mistake. I said, would you like one of these? And a father was like, no, I don't need one. And then I said to one of the kids, I said, we can't ask them if they want one. We just have to hand it to them. So then after that, we just handed it to them. So, we're all doing the best we can.
The counseling departments in our district are just amazing in
And-
terms of like the resources they put online
And-
now and all of
And
that.
support them and give them the time to do their job, I guess. I mean, that's easy for me to say. I'm not here figuring all this stuff out. I don't know how you do it,
It's
but
great.
thank you.
Thank you so much.
Thanks.
Yeah,
So
thank you
nice.
so much.
Thank you all. Really lovely to be here. Sorry it wasn't up on the screen, but I appreciate your patience.
Thank you.
Have a great night. Kelly.
Thanks,
Thank you.
John. Thanks a lot.
Appreciate it, and I'll see you the 29th.
Yes. Yes, this, we've been calling this March Wood. No, because every week I've been at Marshwood at an event, so,
Thank you for doing that.
no problem.
Appreciate it.
Thank you.
Student reports?
Did you skip over the calendar?
Yep, sure did. Yep, sorry. That important?
You might want to talk about.
Yeah, that's what we want to talk about. So,
I'm sorry, I did go over there quite a bit, probably.
Quite all right.
John.
Right,
Thank
because
you.
of us, too. That's-
so here's the draft calendar that I'm asking that the board approve this evening. It has school starting on September 3rd for students, and that aligns with the vast majority of the SRTC schools. I believe at this point, I'm not aware of any other schools that are starting prior to August to be able to solve the dissimilar day issue. And so that would put the last day of school, it would be a half day on June 13th, which would also be graduation. Point of clarity, and I know I said it before, I just want to be really, really clear about this, is that the 18th of April is going to be a day that we're having to use as a spacer. It's probably a one-time thing where we're taking that Friday off. That would just be a no school day, no work day for staff or parents. But the reason for that is that my concern is that if we don't have a snow day, then all of a sudden school ends before graduation, and that is not where we want to be. So we want to make sure school end and graduation coincide with each other. So some people might really like that. The ironic part is that is already a dissimilar day, and so us being on that day, it's fine. It's already been taken up by one spot, so it's okay that we do that. But that's probably a 1 year solution to be able to push out the last day of school to be equal with graduation. So. We still do have the 14th of March, which would be kind of our hot conference that we did this past year. We would do something similar again next year. And then we're still working out some of the dynamics once we have the calendar approved. Parent-teacher conferences is some area that we want to talk a little bit more about. I think as an administrative team and work with the teachers around, got a lot of feedback about the conferences, particularly at the middle school. I think middle school is probably the most difficult school to plan the conferences with, whereas the elementary school, you typically have a classroom teacher with, let's say, 20 students in it. To meet with them over 7 hours isn't really difficult. You have plenty of time. At the middle school, it's really, really tight where you literally have like a 10-minute conference. And I think if things get behind, I think people feel like they don't have the time to have the conversations that they want to have. So we're just trying to brainstorm a little bit on how to do that differently in the future. We've had some conversations with the QEA with that as well. So. And once negotiations is complete, we kind of fill in those professional development days. Right now, it looks like we probably go the 28th and 29th of August. Any questions? October 11th, just so everybody's aware that is the SRTC statewide convention or competition. And so that's a day that all the SRTC schools take off together so the kids can go participate in the Bangor, I believe. Does that sound right? Rowan, is that right? Is it Bangor where the competition is?
For the
Yeah.
Skills USA.
Skills
Yeah.
USA, yep. Perfect. Any questions, concerns? I tried every way to Sunday to try to get graduation on the 6th, but it just did not work. So we just have to make sure the seniors have 170 school days. I just did not want to get into the having to go to school Saturdays or, the funky math we're trying to avoid as much as possible.
Yep.
So. And that concludes my part of the report. Student report.
Awesome. I'll start us off with sports here. So spring sports are starting to kick off. Both baseball and softball and lacrosse have all started their conditioning, and the rest are soon to follow this coming week. Boys volleyball had their end of season tournament last Saturday in Falmouth. It was a great day and everyone did very well. Varsity came in 3rd out of 12 teams, and everyone's getting ready and excited for next year. So I'm moving on to Student Gov, and kind of going off of what Sally had just talked about, we had a SEED presentation here last week, which is students ending substance abuse and reliance. And it was an assembly in the auditorium, and there was 3 people who came forward, and it was impactful because it wasn't just a teacher standing up there giving you statistics. It was stories of people who had experienced loss or addiction. coming from students who had just graduated recently or in college. It was a great turnout, and the discussions that were had were impactful. I know I was in the library and we had to go around tables answering questions that were written on pieces of papers of who do you think you can go to? How do you think, like, what about accessibility makes substance abuse different? It was questions about why don't you go to teachers? And it brought a lot of discussion. And I know Miss Decker has all the papers that she's going through them and trying to form answers for teachers, because I know a lot of teachers were there like, why is this the case? And so I think a lot of good things will come from that. It was very impactful, and I hope we can do more with them. We did have an advisory watch of the seed presentation, and it went very well.
Great.
Also, Student Gov board members had a meeting with Mr. Hoopturp last Friday during advisory to talk about SAC passes and attendance use. There's been a lot of turmoil when it comes time for the new quarter to start, just because students get upset when their attendance, it all falls into place. So we're just trying to get a clear cut of what is expected of you, attendance, what it looks like, college visits, sickness, vacations, just trying to put it all so it's clear cut and not easy to weave through. So we're just trying to improve that, to improve the culture in our school and then attendance overall. James.
So for extracurriculars, we had the 8th grade orientation night this past Thursday. It was really great to see the high school come together, put on a really great experience, giving tours, and they had representatives from all of the clubs in the gym, so people could go around and sign up and for an email list and things like that. Lots of candy around as well. Interact had their big community closet clean out, which went really amazing. There were lots of helpers, and they were able to go through all the donations organized by size and donate some close to Goodwill as well. Civil rights team right now is working on getting involvement for York's annual Youth Leadership Summit, which I think Sally was talking about while she was here. Mamma Mia, our spring musical, has its shows right around the corner. The cast has been working really hard to put together songs, dances, set, and costumes, so don't miss it. Their performances are on the 29th at 7, the 30th at 7, the 5th at 7, the 6th at 2 p.m. and 7 p.m. And then math team has been practicing and preparing for their state meet, which is in April. So yeah, it's pretty awesome.
I misspoke. We'll vote on the calendar of the next meeting. I'm sorry. As long as there's no questions about it this year, I'll be in the final draft for this same dates.
Okay.
Figure it out next week. I'm sorry.
Yeah.
And that concludes my report.
Very good, thank you. No correspondence to report on. Report of the committees. First up is Finance and Facilities, which met at 5 o'clock this evening. I'll do the numbers, and Heather, you'll do the rest of the stuff. So for February, the general fund cash balance is in decent shape. Not too much fluctuation. March is a 3 payroll month, and it's the last of the 3, so the March numbers will be interesting to look at when we get them. Revenues and expenditures are running neck and neck, very, very close to each other, closer than I've ever seen them. And a little bit behind budget, I should say ahead of budget. But again, with the cash balance being where it is, we're in good shape. Adult education is still very high in the black and on that sort of spend down trend to get to 0 by the end of the year. Food service continues to be profitable. Federal grants, we're still waiting for this year's stuff to come in because we're still collecting last year's stuff. Yeah, we're about 2% higher in terms of the percent total spend than a 12-month budget divided by would predict. So
67%.
that feels like it's in good shape.
Okay, yeah, sure thing. Facilities update. So you'll see later on in the agenda tonight, we're going to be doing a bed and boiler project. They're going to do a lease rather than an annual payment. So we're going to just help that. I think that lease is going to help manage the district cash flow a little bit better, going to the monthly payment And then we're currently looking to buy one of those construction lifts, those baskets that will help with painting and it's not called tipping with the bricks, but the sealing the bricks of the various buildings. This would save quite a bit of money because we'd have our current staff utilize that lift. The cost we're thinking is going to be about $70,000 to $75,000 investment to purchase such a lift. Just knowing that they're very expensive just to rent for short time frames. So we're looking for creative ways. So if you have a lift that you would like to sell, let us know. Transportation update. We're very excited that a new mechanic has been hired, a very seasoned individual. They're still going through the process of interviewing a transportation director. Hopeful that the transportation director, Heather, will maybe hopefully stay just for training, so that it can onboard a new director in the future very shortly. The SVPP grant, which is the safety grant, the proposals for the work for the camera and the security door project are due on Friday. So basically, the proposals will be reviewed, and then we will probably know where we're going by the end of the month. Food service update. It seems to be going well. Administration met with Chartwells, and in February, 81% of Marshwood Middle School students utilized the food program, which is wonderful. A new dish machine has arrived at Great Works School, and then we're lining up getting an electrician and a plumber to actually hook up that new machine. Energy efficiency and recycling initiatives. So they had the administration has had conversations with the competitive energy services, and a new agreement, a 3-year contract was signed for natural gas. This is a minor savings over the prior contract. This new contract will begin July 2024. We also had a new 4-year contract for electricity signed, and this represents a major savings over the prior contract, which this one will, though, not begin until January 2025, so a bit of time. And then the solar credits are coming in. So our last electric bill or credits was whatever, the 1/3 to a half less for electric than previously prior to getting in with the solar farm. I think that's it.
Awesome, thank you.
Yeah, great. Thank you very much.
Yep.
Okay, ed policy. Next meeting is March 27th. We have a bunch of second reads on our agenda for tonight under new business. Anything else from the ed policy committee? Okay. And then Wellness SEL will next meet on April 3rd. Come on.
Can we set the time for that now, just to avoid any confusion, because we're gonna have a workshop before that.
Oh.
And so do you want to do the workshop at 5, like from, 5 to 6, and then do the wellness meeting after that?
I think we should do wellness
Other way
first.
around. Yeah.
Yes, thank you.
So we will do wellness from
5 to 6.
5 to 5:45. What is the,
Yeah, we did.
Next meeting is 3 elementaries and special ed.
so that's gonna probably be a big one, so we're gonna want probably the full hour,
Yeah.
hour and 15 minutes. So it'll be 5 to 5:30, and then we'll do 5:30 to 6:45 will be the budget presentation. That's gonna kind of meat and potatoes.
Yep.
Okay, all right, perfect. I'm sure Dr. Dier knows that.
Okay.
Sorry.
No, that's, I'd say it was quite
You just said 5 to 5.
productive.
5 to
5 to 5:30 for wellness.
Okay, that concludes the reports of the committees and brings us to new business. And we'll start, if I may have a motion, please, for the nomination of Robert Cheever.
I move to approve the nomination of Robert Cheever, first-year probationary teacher, social studies, Marshwood High School, school year 2024 to 2025, BA 03, salary pending contract negotiations.
Second, Heather.
Heather, thank you.
Bo has been with us for 3 years and just doing really an incredible job. He's filled in on a number of long-term substitute opportunities for us when we needed him. He has been working on his master's degree at the same time, and so he has now applied and been offered the job as a social studies teacher at Marshwood High School. So really just appreciate Bo. I think he makes a great difference to the culture in this building, and so we're really excited to have him on board as a teacher in the social studies department.
Comments or questions?
May I just say one thing real quickly?
Please.
Right now, we have BA3. His degree would be conferred in May, and then that would change at that point in time. Yes, we can't put a dollar amount down because we're in the midst of negotiations right now, but just so everybody understands why it's the language is the way it is. Thank you.
Okay. Comments or questions? All in favor? Okay, that's 5-0, thank you. Have a motion, please, with regard to the nomination of Lauren Welsh.
I move to approve the nomination of Lauren Welch, first-year probationary teacher, math, Marshwood Middle School, school year 2024-2025, BA2, salary pending contract negotiations.
Second, Lisa.
Lisa, thank you.
So Lauren would be joining us. She is currently a student at the University of New Hampshire, where she's just finishing up her master's degree. She's currently doing an internship and done some other teaching at Noble. Really excited to have Lauren on board. We had to do a little bit of a hard sell yesterday afternoon to make sure that we were able to get her to come here. Really excited that she's going to be joining us. The energy and the experience that she brings, really student-centered, student-based. Just really great questions that she asked the district, which is always really a really good sign. People that have thoughtful questions about the work that we do. So really excited to have Lauren on board at the middle school next year.
Okay.
This would be a mathematics position, I'm sorry.
Comments or questions? All in favor? 5-0, thank you. Motion, please, with regard, and this one needs to be read exactly as it's written there. So whoever wants to make the motion around the lease purchase.
I move that the resolution entitled Resolution to Authorize Lease Purchase of a New Van and a New Boiler System at Marshwood High School in the principal amount of $281,613 be adopted in form presented to this meeting.
Second, Jen?
Jen, thank you. Well done. We talked about this in F&F, and we briefly reviewed it earlier this evening. Anybody on board have questions about it? All in favor? Okay, 5-0, thank you. Motion, please, to approve the use of our transportation for South York Rec.
Move to approve the NSAD 35 transportation by the South York Recreation Department to the attached list of summer program trips.
Second, Jen?
Jen, thank you. And that list is actually, I think it's attached to the agenda. I think it's in the back. Do we have that right? It is. Last page of the agenda.
Saco River tubing this year.
Saying Saco River brings up a Van accent to me all the time. Right there fast.
Okay, any comments or questions? Look that we do this.
Do we also do the transportation for the Elliott Rec Department?
For various things.
Yeah, and we typically, we have to bid those out. Typically, they'll come and ask us for bids.
I just remember one year that it wasn't included, and it was like this big, huge problem with it.
I think they went with it.
That's okay. I just didn't know
Yeah.
since we
Yeah.
could
The
have
administration.
there's something in here.
I think we also, years ago, we did the Kittery Recreation Department for 1 year as well. So I think that stopped.
They do their own
Yeah,
thing.
yeah.
Okay, other questions? All in favor? 5-0, thank you. Motion, please, to take the second reading of DB.
I move to approve the second reading and adoption of policy DB, budget for development and adoption.
Second, Jen? Sorry.
I wondered. Anybody wanted the second? Okay,
No changes from that.
yeah, no changes from last time. Questions? All in favor? It's 5-0. Thank you. Motion, please, with regard to the second read and adoption on DB-R.
Move to approve the second reading and adoption of policy DB-R, budget development and adoption administrative procedure.
Second.
Rebecca?
Nice.
Okay, same thing, no change from last
So
time.
to put in clarity, the R used to be our former policy. we created the new policy, which is now DB, and then our former policy, which is more prescriptive, became the procedure for it. So that's why it's the way it is.
Makes sense. Questions? All in favor? No, thank you. Motion, please, with regard to second reading on EF.
I move to approve the second reading and adoption of policy EF, nutrition services, unpaid meal charges, and prohibition against food shaming.
Second, Heather.
Heather? Again, second reading, no changes. Questions, comments? All in favor? No, thank you. Motion, please, with regard to EFBA.
I move to approve the second reading and adoption of policy EFBA menu development options, offer versus serve lunch concept.
Second, Heather.
Heather?
I'm sorry.
No? Same thing. Second read, no changes. Comments or questions? All in favor? 5-0, thank you. Second, motion, please, with regard to EFC.
I move to approve the second reading and adoption of policy EFC, school nutrition services, free school meals for all students.
Second, Lisa.
Lisa, thank you. Again, second reading, no changes. Comments or questions? All in favor? Also 5-0, thank you. Motion, please, with regard to EFE.
I move to approve the second reading and adoption of policy EFE, competitive food sales / sales of food in competition with school nutrition program.
Second, Lisa.
Lisa, thank you. Same thing, second read, no changes. Comments or questions from the board? All in favor? It's 5-0. Brings us to the next page, which concludes our new business and brings us to our building administrator check-in, which we have just one tonight.
Okay, we've had lots of things happening. We just had our talent show today. The kids practiced with us in the assembly. I had an assembly this afternoon. The talent went from knock jokes to our guitar band. It was students just getting up there and risking it all in front of their peers, which is a very scary thing. It's beautiful singers. It was just pretty amazing. One kid mixed up the Rubik's Cube and then another kid fixed it right there. So it was really nice and impressive. So they're done performing about an hour ago for the families. So they were all excited to do that. Student Council held a migration movie and hot chocolate on Monday, and we had a great turnout for that. We had a field trip with some selected students that went to the Kittery Art Collaboration. So they went there, they were exposed to different art pieces and then created some of their own art, which was nice. Our MLTI day was amazing. We have some more exciting news that I can't share now, but I'm excited to share with you the next time I'm here. But it was a fantastic day. The kids loved it. So thank you, Mrs. Macedo, for putting on such a great job, and all the other allied arts. We had our 7th grade dance. Oh God, it feels like years ago now, but it was only a couple weeks ago. And I cannot tell you how proud I was. So we had kids in the gym dancing, kids in the kids in the cafeteria dancing, then kids playing basketball in the gym, and then another room for games. And they were all so well behaved, and they just had a nice, good old fashioned fun. So it was really cool. On the 27th, 6th grade chorus is going to the Augusta State House, and they will be singing the national anthem to start the morning sessions of the House of Representatives. So we're super excited. So Chris Bison has done an excellent job to get that all together, and she did an excellent job with the talent show. They also participated in the district choral workshop, which was fantastic. We are having our end of we combined March and February for our core values for our Hawk Assembly, and it was courage. So we'll be celebrating those students at the end of this month. The chorus students are also going to the Maine Mariners game on April 5th. Well, I put the 7th grade dance down twice, so that was how fun it was. We had a great book fair, so thank you to Chrissy Corvo. The kids were really excited. The great thing about that is all of the kids helped, a lot of the kids helped work on parent conference night and stuff like that. So she really incorporated the kids. So it was really nice. Our math interventionist is off and running. Katie McGinnis has done an excellent job. She's already collected, excuse me, data and is off running with kids that are getting that intervention help that they need. Our bar coach comes tomorrow, so we're excited to get some feedback of how we're doing from there. Well, I didn't write down the date, but the Hardy girl, about 13 girls are going on a Hardy Girls trip, and they partner with girls and non-binary youth, and they ignite curiosity, thinking critically, building collaboration, and challenging the status quo. And these are students that have expressed wanting to be leaders, so we're just trying to increase that goal for them. The Iditarod, the 6th grade are doing, and they're having a guest speaker. And so they've been studying how sled dog racing happens. So they're having them come in. So we're excited about that. And then on the 29th is going to be the 8th grade dance. And then we just want to thank the PTO for the snacks for the parents on parent-teacher conferences. Thank you.
Great, thank you.
Thank you so much.
Okay, any last thoughts from the board? Entertain a motion to adjourn.
I one thing. Just
Oh,
one thing.
sorry.
Sorry, I didn't get it out fast enough. Upton, Jeffrey Upton.
Yes.
Yes,
28th, I believe.
yes.
Thursday, 28th.
Yeah, so just wanted to make sure there is an RSVP for it. So if anybody wants to go, I can give you the phone number that you need to call. It's in my email.
Yep.
Or either that, I'll just forward it.
Tickets $20, I think,
That's correct.
and it's the administrator at the police station that's doing the
Police fund, I
coordinating, I
think, is what they're
believe.
doing.
Yeah,
That's how it's been.
Wendy, yes, shoot, I can't remember her last name.
Yeah.
Okay, anyway.
I am not gonna be here that week.
Oh,
So I just
I'm going.
great. Okay, I just wanted to make sure.
Yes.
You have some representation.
Oh,
He's amazing, and we owe him so
in my
much
calendar.
gratitude for
Bought my
his
tickets.
service. Awesome, great. Thank you.
Okay, anything else? I will entertain a motion to adjourn.
I move to adjourn tonight's meeting.
Second.
Second, Rebecca, good, thank you. All in favor?